Mr. President, I move passage of Senate Bill 481 and speaking to the motion.
There's the floor.
Thank you, Mr. President. I'm sure we're on the precipice of a real public health crisis. The coronavirus is now spreading, and public health departments across the country and across the world are taking steps. And I want you to know that just a few days ago, the Washington Post published an article stating countries that don't have paid sick day policies have a much higher percentage of workers going to work with the flu and actually going to work sicker than that. Roughly 25% of American workers, and this is true of, it's a little higher in Virginia, have no paid sick leave. No paid sick leave. So here they are, trying to provide for their families, trying to pay their rent, and yet they know they need to go to the doctor and they cannot take time off. What my bill does is it says in Virginia, if you work 30 hours, you earn 1 hour of paid sick leave or paid time off. If you're in an organization where the employer has 15 employees or more. It's really that simple. For 30 hours worked, you are entitled, or you've earned 1 hour. Now, the bill also states, if the company has a paid time off policy that meets this standard, then they're exempt from the bill. The purpose of this bill is to say to Virginians, Virginia employers, and Virginia workers, that we understand individuals sometimes have to take paid sick leave. That happens. The bill also describes the conditions under which somebody could take a paid sick hour or a paid sick day. And it talks about a parent having to take a child to see a doctor, a grandparent or a grandchild or a sibling needing some kind of medical attention. So it does cover family members. Most importantly, there's a cap. So the employee can't earn more than 40 hours a year. That's 5 days. That's the cap. It's a cap every year. If they carry over, they're still subjected to the cap. That's all they get. 5 days. Now think about this. How many times do you need a day here or there to really care for the health of yourself or a family member? We have individuals who are going into our classrooms, teachers' aides, who have no paid sick leave. They're teaching, they're around our children, they're in child care centers, and they're sick. We have restaurant workers who have no paid sick leave, and they're going to work sick. We have personal care attendants, again, who have no paid sick time, and they're not only going to work, they're assisting a vulnerable individual who probably has a compromised immune system, and yet the caretaker is sick. This is a policy that we need to send to the governor. I know many of you have heard from lots of organizations who can't simply think about how to implement this. This bill doesn't tell you how to track the dollars. It doesn't tell you how to track the hours. You can figure that all out for yourselves. We have no interest in redoing a payroll system. We have an interest in protecting Virginians. The bill will be fleshed out rather probably mightily through regulations. We've had many meetings with stakeholders. Representatives from the Department of Labor and Industry have been at those meetings. The Deputy Secretary of Commerce and Labor has been at those meetings. We are aware that there are some industries out there that are concerned because they operate nationally. We get that. We decided as a group that it was not the right place in my bill to start articulating how a certain industry would either be exempt or not. So we didn't do that. The only thing we did do is we did a carve out for those who are licensed health professionals working in a licensed hospital in the state. Because as we found out, and those of you who work in the hospital world, and I know the senator from Hanover can probably speak to this, there are many specialized individuals who choose to work very limited hours and in return usually get a very generous pay. So in those conditions where somebody's coming in one weekend and that's it for the month, or they're coming in 3 days a month and they don't want paid time off, they can waive it. So that is in here.
Gentlelady, yield for a question.